Well, the promise was to give more Americans access to affordable health insurance and reduce health care spending.
But new at 6, some local doctors say the Affordable Care Act, or Obamacare, is only hurting them. WSBT-22's Kelly Stepsinski is looking into this for us tonight. And Kelly, the health care reform laws went into effect almost 2 years ago.
And Rick, since then, providers have had to meet different deadlines, making sure their equipment, billing methods, and employee training are up to date with federal guidelines. But I talked to some independent doctors not affiliated with larger organizations who say it's too much and it's not fair.
It's been horrible.
In his 27 years as a family doctor,
Too much of a financial burden, too much of a personal burden, family burden, on the family, and it's just hard.
Dr. Arnold Del Pilar says he's more stressed and behind in his work than ever, and he blames Obamacare.
It's exactly red tape.
The overall benefit, if you look at the system as a whole, is tremendous, but for an individual practitioner, it really can become overwhelming.
IU School of Medicine South Bend Dean Mark Fox says the technology aspects of the new healthcare laws are better suited for large health systems, not private practices. He also points to something called value-based reimbursement. Doctors are now paid for the quantity and quality of care they provide. In the past, pay was only based on how much care a doctor gave.
Even to monitor those outcomes and performance metrics, I think, ratchets up the expectations.
The question is, am I going to do it for free, or am I going to do it to get paid with?
Del Pilar gave an example of a patient with a swollen knee. He wanted to give that patient an injection, but because of the Affordable Care Act, says he had to stop and call an insurance company to get permission.
The bottom line here is, whether they give me permission to do it or not, I'm going to do it because it's medically necessary.
Expectations, he says, are forcing him to outsource some of the work created by the Affordable Care Act.
I have to hire so many more people just to stay in compliance with all of the burden that they're placing on us.
And Dr. Fox says this might not all be affiliated with the Affordable Care Act. He says one study from 2010 showed doctors on average spend about 20 hours a week on what are called prior authorization activities. That means they're making sure a patient's insurance company would agree to cover certain treatments. I also looked into one of the big arguments during the Affordable Care Act issues before it became law. Some independent doctors worried all the extra work and requirements would put them out of business, but it's too soon to tell if that's true. A spokeswoman from Indiana's State Medical Association told me there are not any state-specific statistics available yet on that issue. I'm Kelly Stopsinski, WSBT 22 News.